testicular pain and also complaints of feeling of a lump in one of the testes, and I'm the senior house officer. My task to do testicular examination. That's my task. Right. Hello, examiner. This is my reference number. Can I please proceed? Thank you. In a real patient, first of all, I greet my patient. I will check the identity of my patient. I'll introduce myself. I'll tell the patient that the purpose of my visit is to examine his private parts, and in order to do that, I'll ask my patient to undress below the waist. I'll provide my patient with privacy and also request for a chaperone. May I know, please, is this the normal anatomical position of my patient?
Yes, it is.
Thank you. Can I please lift up the mannequin?
Yes.
I'll ask my patient to stand up. Thank you. Right, I'll ask my patient to lift up his water pipe. Right. On inspection, I cannot appreciate any redness. There's no discharge, scar, sinuses, or any swellings. I can appreciate normal scrotal rugosities. Both testes appear to be at the same level. I cannot appreciate any abnormality on the posterior aspect as well. I'll ask my patient to cough, to check for cough impulse. I'll also ask my patient to lift up his testes to check for French sign. I'll warn my patient that I'll be touching him. Check for any localized increase in temperature by comparing it to the thighs. Look at my patient's face for any signs of tenderness while doing superficial palpation. I'll warn my patient that I'll be pressing a bit deeply this time. I can appreciate the spermatic cord on the left side and appreciate the epididymis. I can appreciate a mass about 2 to 2 centimeters in diameter on the anterior superior aspect of the upper pole of the left testis. It is smooth in surface, it is hard in consistency, attached to the underlying testis but not to the overlying skin. I can appreciate another mass about 1 into 1 centimeters in diameter on the anterolateral aspect of the lower pole of the left testis. It is smooth in surface, it is hard in consistency, attached to the underlying structures but not to the overlying skin. I can appreciate the spermatic cord on the right side as well. I can appreciate the epididymis. I can appreciate a mass about 1 into 1 centimeters in diameter on the anterior superior aspect of the upper pole of the right testis. It is smooth in surface, it is hard in consistency, attached to the underlying testis but not to the overlying skin. I can appreciate another mass about 2 to 2 centimeters in diameter on the posterior medial aspect of the inferior pole, on the lower pole of the right testis. It is 2 into 2 centimeters in diameter, smooth in surface, hard in consistency, attached to the underlying testis but not to the overlying skin. Do fluctuation test. Fluctuation test is negative on all of the swellings. I'll ask my patient to lie down on the couch. Can I please have an illuminoscope? Can I please have a torch? Thank you. Do transillumination test. Transillumination test is negative on all of the swellings. I would thank my patient and ask him to dress up. Ideally, I'll finish my examination by doing a rectal examination, all of the stomach examination, as well as I'll examine the lymph nodes as well. Right. Thank you very much. My differentials? My differentials are, it can be a testicular tumor, epididymal cyst, hydrocele, varicocele, as well as hernia. These are my differentials. Completing one. Thank you.